Hello, hello. Hi, Jyoti. How are you? Good to see you, my dear. Hello, friends. Warm welcome. Warm welcome. Hi, am I audible?
Yes,
Hello,
yes.
Dr. Pedra. How are you?
Thank you very much. I'm fine. Thank you so much. Very warm welcome to all of you. I am not. Is the backend team there? I'm trying to switch on the video. The backend team is there. Let me settle. Jyoti, I think you are the co-host, and
Yeah, I need to change those settings, right?
yes,
To open
yes,
your
probably.
camera.
Yes, because I was about to attend the congrats meet. All right, so thank you very much for an overwhelming response, everyone. And we are super proud of your efforts and the way you guys have been participating. Today, we are doing another important task. And please make sure that you guys ask all the questions which are the expected ones for coming up in your mind for all the domains. And the role player and the presenter, whatever feedback is being given, that is feedback for everyone, and making sure that you learn the best. Over to Jyoti, and I'm sure that you're going to have a lovely time. Best of luck, Jyoti, and over
Thanks.
to you. Thank you so much.
Yeah,
Thank you.
thank
Best
you.
of luck, everyone. Thank you very much, Akansha, Anisha, Lisa, Amrita. Thank you very much, Meenakshi. Lots of students. Over to you guys. Thank you.
Thank you.
Thank you.
Is Akanksha is there?
Yes, I'm there, but I'm not being able
Yes,
to
I see
switch
him.
off my
Oh, Akanksha.
camera.
Yeah, even I am not able to do it from my side. I have just messaged on the group to allow us to
Yes,
open the video. Just give me a
yes. Right, okay, that's
Akanksha, what I feel that we'll start with the scenario, and meanwhile I have
okay.
posted the things. Yeah, and they'll open the
Okay,
settings, right? Yeah.
all right, okay, that's fine.
Lisa, you are ready? Dr. Lisa, are you ready? She is your role player.
Yes,
Dr. Lisa
yes,
is your role
yes,
player.
I am ready.
Okay,
Okay.
all right, okay.
Good to see you, Lisa.
All right, all right. Try now, guys. I think we are able to open up the camera. They have settled the backend team. Akansha,
Yes,
can you please try now? Oh, perfect.
yes,
Thank you.
ma'am, I've done that. Yeah.
Best of luck, everybody. Thank you so much.
Thank
Thank
you,
you, guys. Thank you so much. Bye-bye. Take care. Thank you.
Just a second, Akanksha.
Yeah.
Yeah. Hope you are able to see, dear.
Yes.
Just before we start, I would like to give a small introduction. Good evening, everybody. I am Dr. Jyoti. Now today we are going to do a very important topic from Urogyney. So this is just a presentation of a Urogyney module. Okay. At the end of the session, I would like to take all the queries related to all the topics of urogynecology module, because I sincerely believe that this is the one module, no, where you there is no chance that you will lose on anything. No? We have very limited topics with urogyney. So this is the one thing which we can be perfect and score full on, you know, for this module. Okay. So let's do it together. Akanksha, your time
Yes,
starts
yeah.
now. This is the only one
Yes,
slide
okay.
dear we have. I can make it a bigger one for you.
Yeah, that would be perfect.
Are you able to see, dear?
Yes, thank you so much.
Take your 2 minutes.
Ghee roast ತಿನ್ಬೇಕಂತ ಸುಮ್ಮನೆ ಪನ್ನೀರಲ್ಲಿ ನಾನು ಮಾಡಿಯಲ್ಲ ಪ್ಲೀಸ್ ಮೇಕ್ ghee roast please.
Can I
ಯಾವತ್ತು
request? Can I request the students to please mute themselves? I again request all the students to please mute your cameras. Only role player and candidate will have open camera mics, not cameras, but mics. Yeah. Akanksha, please start.
Hello, Dr. Kanksha. I'm one of the doctors in the gynae clinic today. May I please confirm your name and age?
I am Julia Davis, 38 years old, doctor.
Is it okay if I call you Julia?
Yes, okay, doctor.
Right, Julia, I apologize. My consultant is away for an emergency. However, he's aware of this consultation and I will be updating him about this consultation. Do you want me to proceed further?
Okay, doctor.
Okay. So Julia, I've gathered from the GP letter that you're having some concerns regarding some lump down below, and you're having some other concerns regarding your urination, and you're here to discuss the same. Am I correct?
Yes, doctor.
Right. Okay. So Julia, could you please elaborate upon your concerns?
I just need a solution for my problem in my water work, and this slump, I need to know its nature and how can I cope with this.
Absolutely. I'll shortly address all your concerns. Just need to ask a few questions. Since when have you noticed this lump, please?
Since 6 months, doctor.
Right. Okay. And is it painful?
Slightly painful, but when I catch an infection from my down below, it become more infected, more painful.
Right. Okay. And how often do you catch infections down below in the water pipe or the water bag?
Multiple time, and I go to my GP and he give me multiple time antibiotics, but it recur after that.
Right. Okay. And have you noticed any abnormal vaginal bleeding or any kind of abnormal discharge from down below?
No,
Okay. And does it pain while you pass urine?
sometimes.
Okay. Can you tell me, do you face any leaks when you cough or, go for any strenuous activities?
No,
Okay. And do you have this of passing urine, maybe like wanting to go to the washroom, but then you might leak in between the washroom?
no, doctor.
Anything of that sort? Okay, right. Okay. And can you tell me, so I'll be asking you a few intrusive and personal questions, if that is okay with you, Julia. But I need to
Okay.
know the details regarding this. Are you sexually active at the moment?
Yes, doctor.
Right. And do you have any problems with the sex, like any pain or any bleeding during or after
Slight
sex?
pain in slight pain during the intercourse.
Okay. And is it during the deep sex specifically, or any time
Yeah,
during?
no, deep sex on.
Okay. Pardon me asking, have you or your partner ever been treated for any sexually shared infections in the past?
No,
Okay. Can you tell me more about your periods? Are they regular?
regular, doctor. The last one since 2 weeks.
Okay. And are you up to date with your cervical screening?
Yes, and there is any abnormality. There is no abnormality.
Okay. And this, just to double check regarding your waterworks symptoms, do you anytime feel that after passing urine, do you feel that there's some trickle going on yet, even after you've passed urine?
Yes, sometimes.
Okay. And do you feel any tummy pain during
No,
passing urine? Okay,
no.
right. And do you feel that you've you've gone to the washroom, passed the urine, but there's a sensation that you haven't completely emptied your water bag? Anything of that sort?
Sometimes, and when I squeeze this mass, there is some secretion come out from it.
Right. Okay. So I took a note of that. Right. Are you aware of your BMI, Julia?
It is 26.
Okay. And allergic to any medicine?
No, no, I
Okay.
am allergic for penicillin.
All right. Okay. I've taken a note of that. And are you medically fit and fine generally?
Yes, doctor. Yes.
Are you seeing the GP for any regular condition apart from your infections?
No, doctor, no.
Okay. Do you have any surgeries in the past?
Just instrumental delivery.
Right. Okay. And coming to that, how many children do you have?
I have 3 children. The last one was by, they are all by vaginal delivery, but the last one, there was a very bad experience. My baby was big in size, and they need to take him out by the fork instrument.
Right. Okay. I'm really sorry to hear that you had to pass through a difficult time. How is the baby doing at the moment?
They are great, doctor. Thank
And
you.
how was your recovery?
It was a little bit painful, but after that I am great now.
Okay. Right. Okay. And do you have any family history of concerns? Any
No, doctor.
diabetes, raised blood pressure, clots in the legs and lungs? Nothing of that
No,
sort? Okay.
no, doctor.
May I ask, do you smoke or drink alcohol?
No,
Okay. And pardon me asking, any IV recreational drugs?
no, doctor.
Right. Okay. And how's the support at home, Julia?
My husband is very supportive.
Okay, that's good to hear. And how have you been feeling in general in the past few weeks? Any low mood or depression, anything of that sort?
Not depression, just I am feeling bad because this issue. I need a
Absolutely.
solution.
Absolutely, Julia, I understand. Julia, is it okay in the front of the chaperone, with your permission, if I could examine you down below?
Yes, doctor.
Okay, so I did hear from the letter that you had some concerns earlier, but so I'll be as gentle as possible, and I will be using some numbing gels also so that you don't feel uncomfortable. However, at any point of time, if you feel any discomfort, you can stop me then and there, okay?
Okay, doctor.
Okay, thank you. So, thank you, Julia, for sharing all the information and letting me examine you down below as well. So what I've gathered from the history and exam, possibly you're having a lump down below. So I will draw it out for you. So this is the bladder, which this is basically the water bag, which we call the bladder, which is connected to the outside through a water pipe, which we call the urethra. Now, at times, the urethral wall gets weakened due to a lot of conditions, in which, in your case, it seems like you've been having recurrent episodes of infections in the water bag and in the water pipe, which we call recurrent UTI. That could be one of the causes. And you also had a difficult delivery in which instruments were used. So that weakens the wall of this water pipe. As a result of that, there are some outpouchings which develop in the wall. So in these outpouchings, whenever you try to pass urine, some of the urine just goes and gets settled down in these pouches, and that's why you feel the lump below, and that's what causes all the pain and the trouble that you're having at the moment. So this, what we call in medical terms, is known as urethral diverticulum. So this is the most probable diagnosis as far as your information and exam findings are concerned. However, I need to evaluate you further. Are you with me, Julia?
Yes, doctor.
Are you understanding what I'm trying to tell you?
Yes.
Okay, right. So Julia, your care from now onwards will be taken by a team of doctors involving my consultant gynecologist, the bladder doctor, the bladder specialist doctor, which we call the urogynecologist, the urologist, the imaging doctor, and the specialist nurse will all be involved in your treatment and supportive management thereafter. So generally, this condition of urethral diverticulum can be managed, but in your condition, it being quite severe in terms of you having recurrent infections, which is not getting treated by antibiotics. So if left untreated, it can lead to infection, and it can also result in stone formation. Are you clear so far, Julia?
Yes, doctor.
Right, okay. So we first need to evaluate further in terms of the bladder specialist doctor will be looking inside your water pipe as well as your water bag through a camera, which we call cystourethroskopy, to see for and to confirm the diagnosis of urethral diverticulum. This is generally an outpatient setting that can happen. And there'll be further specialized imaging, which we call MRI, just to rule out any other organs or structures surrounding your water pipe or water bag is involved in causing your symptoms. We also would like to carry out a sonography of the pelvic region just in order to see whether how much urine is getting stayed back in your water bag once you void it. And we would also like to, after the team of doctors decide for it, like you to
Close the
undergo
Akansha. Time is done, dear.
specialized,
Close. Yeah, very nice, Akansha. Very nice. The part till you performed is excellent. Okay. So Akansha C. And thank you so much, Lisa, being so
Thank
wonderful
you.
role player. Thank you. You did
You are
really well.
welcome. Thank you, doctor. Thank you.
So what we will do, guys, we'll talk about the station first. Okay, I'll give a feedback and then we'll go for a domain-wise feedback, and then I'll take a queries related to this station and also any question in Urogyne module. Hope that is okay. Yeah.
Yeah.
Yes. Okay. So let's go point wise. So Akansha, tell me, what do you think? No, why you are not able to complete the station?
I think when I was explaining the condition to her, I was repeating a lot of sentences to explain the same thing. In the
Okay.
process, actually, I was forgetting my points, so hence I was just repeating those things, and then it just like got. And this is what my problem is: I'm not completing my stations on time, and I'm really scared about that. So because
Mm.
I'm using a lot of many sentences to describe the same urethral diverticulum. So yeah.
Mhm. Yes, Akanksha, that is one point. But let me tell
Mhm.
you, your information gathering was almost 6 minutes, 50 seconds.
Right. Okay.
Hmm?
I got
Okay.
distracted in between because of I think the noise from the background, but
Yeah.
I need to be habituated to that because it'll be a noisy place there.
Yeah. So this is the one most common problem where everyone struggle regarding the
Mhm.
time management. And
Yes.
what it has always been noticed that where you lose your most of the time is in information gathering. Okay. We didn't finish till 5 minutes, 6 minutes. Yeah. So
Mm-hmm.
it is very, very important to be very vigilant what we are talking in information gathering. One point, the first thing, if you want to finish your information gathering in 4 minutes or 4.5 minutes, I'm talking about Urogyne module because you need to ask many questions, right? You should be very, very vigilant about what you are asking. Only clinically relevant questions need to be asked. Okay. What I do mean by a clinically relevant question. So any information which is going to change or help in your diagnosis or management, that becomes a clinically relevant question. So every time before that word or sentence is coming out of your mouth, you should be asking yourself in mind, is this necessary? Is it going to
Mm-hmm.
change my management? Okay, this is one tip.
Mm-hmm.
Second tip, you should be very, very smart enough while you are forming your questions. Okay. See, in that information gathering part, you can't tell your role player to, no, you talk less and this thing. Whatever information she has to talk. Where you can save your time by forming smart sentences. Okay. I'm going to tell you point wise where you were missed. Okay. So
Okay.
that is two things you should be very, very careful. Okay. So if you follow these two things, practice in this way while you are performing with your study partner, then it will immensely benefit you. Okay.
Okay.
Third point, third point to save your point in information gathering, you should be very thorough with your information gathering, basic information gathering template. I'm going to revise you for all of you. The first point in information gathering is confirming patient identity. Second is how can I call you? Third is concern of the station. Fourth is agenda. Fifth is open question with HOPI, history of present illness, which will include negative history also, some red flags also. If it is a gynae case, then comes the menstrual history. Then next one is the obstetric history, past medical history, past surgical history, family history. and then BMI, blood group, allergies, support, and habits. Okay. So all these miscellaneous point will come at the end. Okay. Why I'm saying so? If you're not very perfect here, if that is not very perfect here in front of your eye, you'll keep on jumping from one point to other, the way we did in this station, right? Then you asked about all water work complaint and again went on saying that do you dribble after peeing? Okay, so very because no, believe me guys, a candidate who builds a good information gathering, no, almost you are past there. No, the examiner doesn't bother much about how much you have talked in applied clinical knowledge. If you are not making major blunders, no, you will surely pass that station. Information gathering is a one important aspect where you can make a very good impression, not only on examiner, but even on role player. Okay. So keep that point in mind. Now
Okay.
we'll go to proper this thing. So the way you opened the station, perfect. Okay. I'm really happy you responded to that situational awareness where consultant is absent. Okay. Yeah, that's really. I'm really happy that you mentioned about it is a letter from GP. You're getting information from the letter GP letter which you have. My connection was little bit lost when you were speaking about the agenda, but I'm not very sure. So guys, many a times we do forget na, ki, in agenda mentioning about that you will write back to GP. If you don't do it in the agenda, at least do it at the end of the station. But sometimes in the hurry, at the end of the station, we do forget. It is a very important point in patient safety and communication with colleague. Okay, the lead GP has to be in a loop. Okay. So regarding informing GP. Now, Akanksha, you know where the things started, little bit hazy when you started asking close question in HOPM. It should be very clear. Now at the spinal level, ki history of present illness should start with HOPA. Can you tell me more about your concern? Okay. And every role player will be instructed to give almost 50% of the information in that open-ended question. Okay. And then obviously you ask about all the negative history which is related to lung, like the way you ask any discharge, any bleeding, any pain that you ask, and all urogyny symptoms. No, for all urogyny station, dear friends, even if it is a prolapse case, SUI case, you need to ask all urogyny symptoms like frequency. Do you leak? Do you need to rush? Have you experienced any mass down below? This has to come for all urogyny stations. Okay. Hope you get this. Till this point, it is clear. Yeah.
Yes.
Yes.
Wow.
Then comes the
That's good.
next point. Okay. So in the history of present illness, no, everything was not at one place. Then you started with sexual history, which is very good. You signposted and talk about sexual history. So when you went, see, Akanksha, you asked this role player, is it a deep, what do you say?
Deep sex.
Yeah,
During
no?
deep sex.
Like deep dyspnea or superficial perineum. You expect that for the patient of the urethral diverticulum, it should be superficial dyspnea. Okay. But I do think this is going to change your management. So if she says ki pain hai, that's it. You stop here. You don't waste your sentence. You don't waste your times, even the fractions of second. Okay. So just
So,
asking now. Does it?
since I was given the picture, so it is clear the diagnosis is UD. So I shouldn't be bothered about DD in terms of endometriosis. So I shouldn't go and explore that question of dyspareunia, isn't it?
No, I won't really advise you to do that. Ki,
Okay.
totally shouldn't be asking any negative history and just go with the urethral diverticulum. But why? Because sometimes, Akanksha, it does happen in the exam when you come to the diagnosis. No, once you finish information gathering, they'll show you the picture. Getting my
Okay.
okay?
Yeah,
Whether
yeah,
it is
yeah.
hurt, she told you, you just acknowledge, okay. Na? Then
Okay.
you don't ask whether it is deep, superficial, that thing. Na? Yeah.
Okay.
But ideally, after history of present illness, menstrual history should come. Okay. So,
Okay.
what is important in menstrual history, Akanksha, for you? This lady, 38 years old, right? Okay. So, what is important is LMP, no? Right? Yeah. The
Because he's
second is
reproductive. When was
hurts
your
during period, no? Because it is one differential diagnosis is the endometriosis. Hope this is clear.
Yeah.
Yeah. So after HOPM, menstrual history will come. After menstrual history, dear, obstetric history should come. Which role player prompted you? When did you ask about
after
this?
the surgery? Yeah, I forgot.
Role player prompted you. This is very significant. She's telling, and don't go into detail how deep with this thing, how your babies is doing. You just acknowledge, I'm very sorry, you've gone through a lot. That's enough. Okay. How baby is doing is going to change your management now. No, no. Why? है ना? You just acknowledge, and that is sufficient for your communication with patient point. है ना? Yes.
Yeah.
See, smears. No, asking the question of smears. I don't support asking this question. See how it is going to change your management. No, skip on. Skip on it. Happily skip on. No worries. Okay. Then
Okay.
you asked about me BMI, allergy, and then past menstrual history comes. So Akanksha, while asking the past medical history, you did ask me whether I suffer from any medical elements, and second question was, do I attend any GP? Okay, so both question means same, right? So for
Yeah,
only
I
one,
did ask, do you have any medical condition apart from going to the GP for recurrent infections? I said that.
let's make it very simple, dear. Do you attend GP for your any medical concern?
Okay.
Should be 2 seconds only, है ना? 2 seconds. Past
ठीक है.
surgical history, I do understand, dear. Family history, this condition doesn't run in family, so not
Yeah.
needed. Family history, happily you can skip on. Habits also, guys, focus, but try to make only one sentence. Okay. Do you drink? Do you drink or no smoke, or pardon me, to ask any recreational drug? One sentence. Okay, you are not wasting money. So do you drink? Do you smoke, drink, or pardon me, to ask any recreational drugs? One sentence only. Okay, not wasting time.
Okay.
है ना? Then support,
Yes.
support was good. Mental health is good. Only one thing, Dr. Akanksha, any patient who is going for surgery, she might require surgery. You need to ask for blood group and Jehovah's concern. You never know, it can be a hidden agenda also, right? Okay, very good.
Okay.
है ना? So this is all about information gathering. Okay, hope you got it. You have covered the
Yes.
but I don't want any of RFA students just to be just to prepare, just to pass the exam. Okay, I don't want. You should, everyone should aim for that gold medal. Okay, so we'll prepare in that way. Hope you got it. है ना?
Yes, absolutely.
Now coming to the next point, you would like to examine her, and you said, I'm really happy. You said that you will be, very gentle. You will use this numbing gel. You can always ask. No, it has mentioned he couldn't examine his detail. What was the concern? No, did she had any? So that you can prepare yourself accordingly. Okay. So after examination, you have seen this picture. That is good. I'm really happy the way you explained urethral diverticulum, but I want you to make it short. Okay, you have shown a diagram that's very nice, you know? But no, see these complex diagnoses. I'll tell you, like Fowler syndrome, mixed incontinence, this urethral diverticulum. You can just simply, this is not a bad news. No? You want somebody with you because I'm giving a lot of information. This becomes a good point for the communication because this is something not very common, no, Dr. Akanksha. This is something different. Okay, so do you want somebody with you? You can just ask. This is not BBN. I'm repeatedly telling this thing.
But I
It is
do
a
need
good
to
point.
ask. I still do need to ask that. I see you alone today. Do you want somebody to
So do you
accompany?
want? I can see you can ask Akanksha because it becomes
Okay.
like if somebody is there with this complex diagnosis, it will be better for her. No? So in that, this is not a bad news. No, we are not doing a bad news. Okay. Then the way you explain, guys, just one practical point I wanted to share with you. Many a times what happens in an exam, we start explaining something to the role player with the help of a diagram. And what we do, this paper and pen will be pointing towards our side. We never bother ki we should show it to our role player also. No, be very careful about that. Okay, keep
Okay.
taking pauses. Keep taking pauses while you explain about the diagnosis. Okay. Uh, After every 2 sentences, at least you don't, even if you don't utter those sentences, are you with me? Just take a pause. No, go a little bit slow with this. You can just mention it is a draw diagram and it is a outpouching. Because it is outpouching, urine gets accumulated and then you have a repeated infection. We call this condition as a urethral diverticulum. Happy with that. Then in between also, no, you were the way you showed empathy was really good. Then coming to the diagnosis, management. Okay, I'm really happy the way you explained about the MDT, who all will be involved. So, Akanksha, first of all, you need to confirm this diagnosis, as you rightly said. Urogynecologist is going to do that. But what are the here now comes the role that you should show your some applied clinical knowledge part. Okay, so see what our talk article says. Akanksha.
Yes. Yeah.
Yeah, the
It
first
could be
investigation after MDT, the first investigation is urine routine microscopy has to go, because now she has this. Okay, so don't forget some basic things now. Then a specialized investigation, which we call as a video urodynamics. It is not any case of urethral diverticulum will not be taken for just direct surgery without doing specially urodynamics. In that special test is video urodynamics. So this video urodynamics has to come to show your applied clinical knowledge to your examiner. Okay. And then you can say that we have some special. So see dear, what are, I'll show you. Just a second. Yeah. Just a second. Mentioned is the gold standard.
okay. Hello. Hello.
Hello, I am hearing you, doctor.
Yes, yes. Hello. I think her connection got lost, yeah.
Yes.
Yeah, Dr. Akanksha, am I audible now?
Yes. Yes, you're audible now. You we lost you in between, yeah.
Yeah, it's raining over here.
No worries, that's fine.
Yeah, we were here, right?
Yes.
Yeah. So I want you to mention these 4 investigations. Okay.
Okay.
And just names. Okay. Don't go on explaining anything in detail. Okay. Not required. Okay. Now you come to the surgery. Okay. So surgery, what you will do, this you need to explain, not in detail explain. So who is going to do this surgery? Specialist urogynecologist who has experience in this, because this becomes a complicated surgery. Okay. Then just take the names, no? Endoscopic re-roofing, diverticulotomy, malsupilization. Okay, just take
Okay.
name. If time
Okay.
permits, just explain in 1 or 2 sentences. Otherwise, it is not needed for at your level to explain these surgeries in detail. Got my point?
Okay. So in the PIL with of UD, they say that we will excise these outpouchings and stitch up the deficient. All that has to be said.
Yes, you
No.
can see. You can say that general point that will excise this, no, and do this. And we have
Yeah.
these surgeries which we call as the endoscopic re-roofing. And if time
Okay.
permits, the most
Okay.
good one is diverticulectomy, right? Yeah.
Right. Yeah. Just remove it. Yeah. So I'll leave you with some patient information leaflets so that you can go through in detail and then come back to us.
Yeah, because this is some complex thing. Nobody wants
Mm-hmm.
you to explain in detail, but
Okay.
you need to explain just a bit of a point. I think where you touched that point where you need to mention what could be the complication of urethral diverticulum, and if it is bothering you a lot, you need to get treated for it. Okay. There is another aspect of management which talks about in the talk article also. In the initial part, they have spoken about conservative management, where what we do, just treat that urinary tract infection. We don't do anything active, right? So
Yeah.
just touch one with one sentence, that point also. Okay. But this patient is having recurrent UTI, so
Yes.
with your consultant opinion, she will need treatment.
Right. And she's not recovering with multiple courses of antibiotics, so she doesn't qualify for that kind of concern. But I can say, but it's not
Yes.
suitable in your condition. Probably. Yeah.
Yeah.
Okay.
Okay. So hope this is
Right.
clear. At the end, you will give her patient
Yes.
information leaflet. You will
Absolutely.
write back to GPDF and fix an
Yes.
appointment with your consultant because she has
Consultant.
not.
Seen the consultant. Yes.
Yeah. So dear, let's mark. So for me, information gathering, I will score 2 by 2. It is a pass, complete pass. But I'm little bit
Yes.
more this thing. But you
Got your
should be in a
points.
proper format, very relevant. That thing you need to mind. Okay.
Okay.
Communication there is very good. 2 by 2. Communication with patient, it is a pass. Okay. Patient safety, I kept you borderline and applied clinical knowledge. I kept you borderline there just because we were not able to complete the session.
Okay.
Yeah,
Okay. Yes.
good. So let's open this session for the questions for everyone. Yeah.
Please repeat the treatment, please. The
Yes.
treatment.
Yes, dear. Yes, Dr. Banu. See, this is the first line of what you can say in a layman term. You can just say we will excise this outpouching and suture the and put some stitches. That's it. Okay, just a one. So we can do it by 3 methods, which we call as the end one. The first thing which we call as an endoscopic re-roofing or this transurethral resection. Okay. Uh, you need not go into explaining in detail about what it is. Okay. The next one is called as a malsupilization. Basically, the malsupilization is done only in a patient. Just a second. Yeah. See this one. Okay. Transvaginal malsupilization. Only patients who are frail. Okay. Not much advisable. The best results are with this. Okay. Diverticulotomy. So what I'm trying to say that to show your applied clinical knowledge to your examiner, you can just take names of this surgery and to explain the patient, we'll excise this pouching and suture it back. Got it, Dr. Banu, what I'm trying to say?
Yeah, thank you. Thank you, ma'am. And what about the complication of surgery?
See, I don't think you will go till there. Okay. So if time permits, if you feel you still have time, then the common thing, no, this can reoccur. Okay. Stress incontinence could be there. No, you might have some problem. Fraying of the urinary stream can be there. No, infection, bleeding, all those common things you can always talk about if time permits.
Thank you, ma'am. Thank you.
Thank you.
Ma'am, what could be the other probable questions by role player in this scenario?
See, this topic is very straightforward, dear. We don't have many things. So role player will not take you anywhere. Okay. Do I need any more investigation? What if I don't get operated on myself? Okay. So there you need to explain the risk. Do I need to do some investigation? So yes, 1, 2, 3, 4, which I just mentioned. That's it. Okay. Not many more. In fact, we have covered whole talk.
Okay, ma'am. Thank you.
Thank you.
Ma'am,
Yes,
ma'am,
dear.
should we tell about a differential diagnosis when we discuss the diagnosis, or we can straight away tell it as a urethral diverticulum?
Okay. So CDM, most of the time in exam, they won't make you so much complicated. No, you should talk on some topic. So that is also RCOG's intent. No, so they will give you enough information to say that it is a urethral diverticulum. But
Mm.
you
Mm.
need to ask few important questions in information gathering so that you will come to a differential
Come to
diagnosis.
the diagnosis.
This role player specifically said, no, when Akanksha asked if she press on that swelling,
Yeah.
something is
It's
coming
a
up.
pus discharge. Yes.
Mm.
But
Yeah.
sometimes urethrosil can also be like that, no, ma'am, because when we press, sometimes the urine can come out through that also. And I think
And
more
that is why
specific, dyspareunia or post-micturition dribble, I think everything can be there and like
everything can be there, and that is, and even this picture can look like an urethrosil. Okay.
Yeah,
But
yeah.
usually they will not make so much of complicated. She gave you history of trauma. Urethrosil can also
Okay.
be found after
Yeah.
trauma. That I do understand. But
Yes, ma'am.
usually they will not make so much complicated.
Yes, ma'am. So till at the end, till which point we have to take this station? Because you have said about the surgery, we have to just tell the name, and after that, before how to come to the closure, which all points we have to cover.
So you will say ask her, do you have any doubts? Okay. So this is a patient information, Julia, which talks about this condition in more detail and also about the surgery. Okay. If you have any doubts, you can always come back to me. I'm going to fix an appointment with my consultant, which was like for today's schedule for today. So we'll see you soon, and I'll write back to you, GP. This is the way you will close.
Okay, okay, thank you, ma'am. It was very nice, ma'am, and Dr. Akansha also did well.
Thank you so
Yes.
much. Thank you, doctor.
Yeah.
Thank you,
Any
ma'am.
more questions? Hope this was useful. You will keep remembering all these points. Clinically relevant information gathering. This is very, very important. You will have so much of a confidence if you are able to finish your information gathering in 4 minutes. No,
4 minutes,
you
yeah.
will have plenty of 6 minutes is a good time to explain about the investigations and management, right?
I'm just facing this problem. I'm trying hard on this, but I'm just going 12, 13 with my regular discussion also. And I just need to work on this. I don't know what to do. I'm just scared about that. I've got 3 months left.
Yeah, so practice will make you up conscious. Those 3 points. Always you see, everybody suffers like that. No, even when I was preparing back in like 5 years back. So I also, so what I did, literally, I pasted that basic history template on my study room wall, and like in a TID dose, I used to read it loudly so that I'll not mess up, not like first pass medical history and then something else.
Yeah, also, yeah, got it.
Yeah.
Okay.
Yes. Any
Thank
more
you so
questions,
much.
guys?
Can you show the slides, ma'am? Because connection was disconnected, no, so we didn't see from
Yes,
sequence.
yes, I can show, Anjali. No problem. And on YouTube also you will have that, Okay. Here are a few extra points which I just mentioned you shouldn't be talking. Just I'll show you from the first thing, huh?
Yes, ma'am.
Okay. This is not important, though it is mentioned here. I'm going to edit that. So reference material for this topic, I hope you all know TOG article and patient information leaflet. Okay. We have one patient information leaflet from British Society of Urology. Okay. So that is also good.
One PIL is on the excision of urethral diverticulum from NHS. That's there, and one talking.
这么 case？ 在做 case 哦，今天我做 case， 两个都是做 case 做到一半的时候去做。
Anything more? Anything more, guys? Tell me,
No, that is-
ask me any question related to other urogyne also, if you are comfortable.
Yeah, I wanted to ask a question. We have a very new talk on vaginal cysts, which has a DD of everything. And it goes everywhere. So I'm really scared whether it can come for a SD since it's a very new one. So
Yes, honestly, Akanksha, I have yet to go through this. I don't know about it, but yes, you should prepare it as even this topic, guys. Okay, you should prepare like for SDs also, you know, what all the investigation, what is the management there. Then you should know in detail about how you're going to operate, how you're going to investigate, how patient present, how you're going to examine everything, what relevant information. SD will be like this for urethral diverticulum. Yeah. And as Akanksha, you just mentioned, yes, you need to prepare that topic. Let us see if we can in the RFA course try to involve as a new topic.
And I think the same goes for urethral caruncle also. That's also quite latest one. I mean, after diverticulum, I think the caruncle dog is there. However, the only difference between the two, it's a vascular growth, it's a benign tumor of the urethra. So, but it comes in one of the DDs as for UD as well. So,
yes, but I'm not if you ask me, I don't feel it can come. But vaginal cyst is something which is commonly seen, no? And do face some dilemma with that. So better to prepare that topic.
Okay.
Yeah. Yeah.
Can I ask about, ma'am?
Yes, Sharmi.
Ma'am, so I need to ask whether about this urinary lower unit tract symptoms like the frequency, urgency, the post-micturition dribble, incomplete sensation. So these 4 points should be asked for all the cases. I mean, like for a prolapse and diverticulum and for a vesicovaginal fistula. Does this has to be asked for every these cases?
No, I would say if a patient comes with an SUI, you don't ask all question. But as all four things you mentioned, you should ask here.
Okay, so these 4 we have to ask for all the urogynec complaints. Okay, got
Yeah.
it. And UTI is also common for all the urogynec questions, right, ma'am? The
You
UTI
do
questions.
ask. Yes, that is must question for any
Okay,
urogyn.
okay. So when I was practicing, I felt that apart from frequency and urgency, when we ask this incomplete sensation and post-micturition dribble, it is taking somewhat a bit extra time.
Sharmi, let me make clear. No, I think we are confused. See, if for simple like urogynec, let us consider it is a SUI case. Okay, so don't ask post-op dribbling and those things. What I'm trying to say, if you feel that that is a case of a vesicovaginal fistula, urethral diverticulum, prolapse case, na? In that case, you should ask whatever
Okay.
question. Okay,
Okay.
not for all. Hope it is clear now.
Yeah, yes, ma'am. Got it.
Yeah, good.
Thank you, ma'am.
Thank you. Anything more in urogynec, guys? So what are the topics we have in urogynec? One is SUI, second is mixed incontinence. Fowler syndrome, guys, do prepare. Na? Talk article, it can come as a structured discussion. No, Fowler syndrome, do prepare. You need to prepare some urodynamics. I mean to say urodynamic testing. No, that thing, and all type of prolapse. Okay.
Urinary
That's
retention and Fowler's.
Anything more? Hope you enjoyed. Hope it was helpful. Okay. Keep updating us. Keep giving feedback so that we can help you in all ways. Yeah.
Yes, thank you, Dr. Jyoti. That was very informative. And thank you so much for the feedbacks. Thank you.
Okay, then, guys. See you. Shall I close? Thank you so much,
Yeah.
Poonam. Yeah.
Okay, thank
Thank
you.
you, everyone.
you.
Thank you. Bye. Take care.
Thank you.